principles of treatment. That means, for example, if a person becomes sick in your house, what kind of treatment, like how your family will look at him, right? What kind of treatment you give him? That's the first question. Second thing is that when have you just thought that how these medicines will help the person to come out of the sickness? That is the second one. And third one is, if you sleep for some time, you start feeling better. Why? What is the reason behind that? That is what we are going to see now. So there are two ways to give a proper treatment to the infectious disease. Whatever the infection you get, whatever the disease you suffer from, there are two ways to give a proper treatment to that. First one is, whatever the effects are there in your body because of that, what are the symptoms you have got. For example, you have fever, you have cough, and you have cold. So the medicine which is given here will treat the headache, will treat the cough, will treat the cold, and also it will treat the fever. So all these effects which are because of the infectious disease will be washed out, right? That's the first thing. Now, second one is kill the cause. Now, what is the cause for that particular disease? What is the cause for that particular disease? So why you got that disease? That particular cause should be killed. For example, it may be a bacteria, it may be virus, or it may be other things. So those things should be killed. One is reducing the symptoms, reducing the effects which you got because of the infectious disease. Second one is just killing the bacteria. So what are the treatment you are going to get, right? They will reduce the symptoms. That is what we are talking about. So you take the medicines. So when you take the medicines of the headache or the fever or the cough or cold or whatever you got because of this infectious disease, okay, that will calm down, that will cool down, right? That they will come to normal. And even you are suffering from a loose motions also, when you take the tablets and all, like, they will be controlled. If you have a very severe fever, if you take the medicines, fever will be controlled gradually, right? If it is 1 or 2, it will become 1 or 1, 1 or 100, and then come to 99, and then come to 98.5 degrees. So that is how even that will gradually decrease. So if you have cough, so when you take the medicine, that will not cure in 1 day. So it will take some time. So there is it will definitely take some time for all these problems to get rid. So here, this treatment, now what it is actually doing is, it is only trying to reduce the symptoms here. What are the symptoms are there? They are trying to be reduced. Second thing is that sometimes what we need is the bed rest. So when you have a bed rest and all, you can get the very good energy. So your energy will be regenerated, and with that energy, you can also fight with the microorganisms. So here, now this is the treatment, and then sometimes what happens here is, now the next point is here is symptom directed the treat. So if you go ahead only with this symptom directed treatment, what will happen? So if you are only looking at the symptoms, if you are only trying to reduce the symptoms of particular infectious disease, then the microorganism which is the causative factor of that disease, right? Some microorganism has caused that disease in you, that will not go out. That will still remain in your body. Only the effects have gone out because you are completely, you are looking at the reducing the effects. We are only looking at the reducing the effects. So if you are only looking at the reducing the effects, then the bacteria or the virus or the protozoans or whatever it may be, if they are in your body, now there are chances that even though symptoms are gone, again they can infect your body. Again you can see that disease again. So that is how the first one will be used, that is reducing the effects. And now coming to the kill the cause. So what is kill the cause here? Who is causing the disease here? So basically we all know that microorganisms are causing this disease. So what are these microorganisms here? We already know that there are viruses, there is a bacteria, there is fungi, there are protozoans and whatnot. So all these are the microorganisms which are causing the diseases in us. So now all these are the microorganisms which are so here these are the different microorganisms which are causing the deadly diseases to us, right? So if they are causing the deadly diseases to us, so now it's time for us to kill these all bacteria, viruses, fungi and all the other protozoans which are causing the diseases to us. Right now, it's a known fact that these are absolutely different from the one another. So no bacteria is similar to the virus, and virus is not similar to that of the fungus, and not fungus is similar to that of the protozoan. See, each and every bacteria or the virus or the anything, they will have their own biochemical life processes. Like they have their own way of living, they have their own way of life processes here. So for example, if you take the bacteria, if you take any bacteria, their life processes are same. The kind of mechanism which takes place in their body is same to the other ones. So that's why it's very easy that if it is any bacterial infection, we can give the same kind of medication to them. Okay, but whereas here it's not like that in each and every organism here. So here, if you take the viruses, it is completely different. So here, and if you take the fungi, it is completely different. If the protozoans, they are completely different. So you cannot use the similar kind of medicine for each and every organ. To kill each and every microorganism, you should come up with the different kinds of medicines. Till now, we are trying hard for the vaccine for corona, right? So it's only a virus. It's only a virus, but we are not able to get a proper medication for corona. So till now, all the scientists are really working hard to get the proper vaccination. So now we have certain vaccinations available after these many months. After these many months, vaccinations are available now. So with these vaccinations and all, we'll be able to reduce the number of cases of the corona. Okay, so that means here, each and every organism will have their own biochemical life processes. So they will come into the cells and they will start building their, they will start replenishing, and also they will take the nutrients from a body. They will divide and they will increase their number. So they have their own pathway. They have their own way to manifest, right? They have their own way to come up with the disease. So now what we have to do is, if you are taking a drug, if you are taking a medicine, that should block the pathway. So whatever the pathway they are using, we should block it, so that what happens here, the chain will be broken, and you will not, the microorganism will die, and also there will be no disease at all. So that is how, whenever a drug is used, it should break the chain of the pathway which is being created by the bacteria or the virus or the fungus or whatever it may be. So the drugs which are prepared should block the biochemical pathways and all. And whatever the drugs we are using, that should not cause damage to our body. That should not degrade our body. It should not show any kind of effect on our body. So that is how we have to use the drugs and all. So here, and the best drugs which are available are the antibiotics. So we are studying from the 8th class, right, regarding the antibiotics. So these antibiotics are very, very useful in killing so many microorganisms, especially on the bacteria. So a lot of bacteria, when you take the antibiotics for maximum number of diseases, they are very, very helpful, because they won't cause any kind of effect to your body, but they have the capacity to kill the microorganisms. So now there are so many drugs. For example, the drug which is made from the plant called as Cinchona officinalis, that is Cinchona, the quinine drug, right? That is used to make the anti-malarial drugs, and also that drug is able to kill the malarial parasite. So there are drugs which can kill the bacteria, there are drugs which can kill the parasites. Okay, the drugs there which can break the pathways of these microorganisms, so that the disease will not be manifested. But whereas when you come to the virus and all, their pathway, their biomechanism, or they can say bio pathways and all, they are completely different. Their lifestyle is different, their life process is different, because when they come into a body, they use our body, and they make up their pathways and also, and when they enter into the cells and all of our body, and they will try to change it into our own our structures and all. So if I tell you about the antigen and antibody reactions, we will have a discussion over there. So when they enter into our body, so our antibodies, our body will not be, our immunity system will not be able to detect them, identify them. So that's why they go into our body, and also they can proliferate, they can multiply, they can they'll duplicate themselves, and then they will cause the disease because their pathway is different. But still, even though that is the case, we have many antiviral drugs now. Which we are able to give it to the patients and reduce the viral problems. And all. Now the best example also we can take is the antiviral drugs which are being used for the disease called as the AIDS. So AIDS is a disease which cannot be cured, isn't it? But still, even if the AIDS is not cured, it is even now controlled because of the antiviral drugs here. And the lifetime is only 10 years. If a person suffers from AIDS and all, he can only live up to 10 years. But now it's not like that. He is able to live for some more time, right? Even I know some people who are even studying the degree and also who are in their PG level, right? Because that they suffered from AIDS when they were only 5 years old. So because of the blood which is transferred from one person to the other person, blood transfusion, the AIDS was also transferred from the other body into the body. And some of the children, they got the virus from mother to the child. And even those people are surviving now because of this antiviral drugs and all. Okay, it is called as the ART, retroviral therapy. So this ART, the drugs which are being used, is able to control the AIDS. In the same way, it has taken for us to 8 or 9 months to get the proper vaccination for the coronavirus also. So scientists are trying maximum best to get the different kinds of drugs for the different kinds of viral diseases and all. So that is how these are the principles of the treatment. So these are the two ways right now. We have to reduce the effects and also or kill the cause. So that the best thing is that kill the cause so that you will not be infected again. So children, by this we come to the end of today's session, and tomorrow we'll see principles of prevention. So until then, have a great day. Take care.